Hey everybody, we're going to do the notes on blood pressure and neural control. And when I started looking at these topics, it seemed to get a little bit long, if I'm being honest. So I want to split this up into two parts and let you listen to half and then take a break and then come back and listen to the other half. And that's how I'm going to record it. I'm probably going to need a break by the time we get through blood pressure, and then we'll come back and do neural control by itself. This is one of the bigger topics in the physiology of the heart and how it's controlled by your brain and specifically your brain stem. But in order to understand that neural control, you have to understand what blood pressure is. And so these are going to be handwritten notes. Let me pull up my document camera and we will write these down, and I'll write with you to help you out with timing. So first, let's just call this blood pressure. Okay, blood pressure we're probably all familiar with. You've probably seen commercials for various blood pressure medications or high blood pressure. Maybe you've heard parents or grandparents talk about having high blood pressure and some ways to combat that issue or things to change in your daily life to prevent high blood pressure. But first, what we're going to do is start out with the definition of what blood pressure is. No abnormalities here, just a straight definition of what blood pressure is in your body. And it is the force that is exerted by blood against the inner walls of blood vessels. And specifically, we're going to talk about blood pressure that is arterial pressure, or the blood pressure that is found in the arteries. And it's usually measured in the arteries. It's measured in millimeters of mercury, and that measurement comes from the force that is exerted by blood against the inner surface of the blood vessel, against that endothelium, which is the wall of the blood vessel, and what we refer to mostly is arterial blood pressure. Okay, so let's write in here that this blood pressure is usually arteries. Okay, and that is arterial blood pressure, okay, found in the arteries. And most of us would measure blood pressure or would be familiar with blood pressure based on a number. You go to the drugstore, you go to Walmart or wherever, and you put your arm in the little sleeve and it will measure your blood pressure. Or you go to the doctor, and then the nurse that you see first will take your blood pressure. They'll put the cuff on your arm, they will read that blood pressure, and they will give you your recording. That recording is typically, or is always, in millimeters of mercury. And we're going to go with the normal range for blood pressure. Most people's blood pressure will teeter around 120/80 millimeters of mercury. Okay, now that is the pressure exerted against those arterial walls on the inner surface. And this top number is called the systolic pressure. And we've talked about systole before. Systole was contraction. It was when the ventricles were producing a high pressure due to their contraction. So this systolic pressure is going to be the maximum pressure achieved during left ventricular contraction. Now, it doesn't mean that the right ventricle is not important. It is important. Obviously, it's got to get that blood to the lung, but the reason that it is referring to the left ventricular contraction here, the pressure from that left ventricular contraction, is that's going to be your greater pressure because the myocardium of that left ventricle is so much thicker. On the bottom, we have the diastolic pressure. And the word diastole means relaxation. So this is the lowest pressure achieved during left ventricular relaxation. Okay, and I've taken many a blood pressure in my time, and people will always say, well, are you worried about it? Was it okay? Am I all right? And I'll say, well, I'm not as concerned about the top number as I am the bottom number. And I do this with my parents. I do this with my husband. I always pick on him or my parents about the bottom number, because that left ventricle is supposed to produce some pressure when it contracts in the walls of those arteries. But the bottom number is more telling. The bottom number means that when that ventricle is relaxed, how much pressure stays within that artery? What is the lowest pressure that is inside of that artery at that point? And if this bottom number is too high, then it means that that vessel cannot rest. That vessel has too much tension against the walls, too much pressure, and it's going to stress out the walls of those arteries. It's going to wear them down over time. And even a bottom number of 85 consistently, okay, so a consistent reading of 85 puts you at a pre-hypertensive state. It puts you in the beginning stages of high blood pressure. And that's scary because, I'm young. I don't want to have high blood pressure, but if I were to constantly take my readings and they were at 85 or greater, then that would put me in that category of, oh, we're going to keep an eye on this, because if you don't fix it, then the arterial walls can stress and they can wear down and they can be diseased over time. And so that bottom number is important. Not that the top is not, okay? So don't get me wrong. If somebody that's got a number of 200 on the top, that's the problem. But it's not, to me, it's not as telling about the health of the vessel and the potential health of the heart. But this is an average, okay? An average reading of what is normal and what is healthy. Some doctors and nurses and pharmaceutical companies will push 110 over 70. And that's even more common for female normal ranges. We may be a little bit lower than 120 over 80 just due to body size. And it may be due to you. Your normal may be a little bit lower than that, and that's fine. It doesn't mean that you are hypotensive or that you have problems. If your normal is just 110 over 75, that's okay, because your body frame might be slightly different. But when you get above this net number consistently, then it's time to talk to a medical professional. Now, if you do, okay, let's say parent, grandparent, you at some point experience numbers that are too high, then you can be diagnosed with something called hypertension. We would just commonly call that high blood pressure. Okay, and high blood pressure is when you get persistent readings that are greater than 140 over 90 millimeters of mercury. Okay, remember that 140 is your systolic number. That's the max pressure achieved when the left ventricle contracts. The bottom number is your diastolic number, and that's the lowest pressure achieved whenever that left ventricle is relaxed. Hypertension, definition-wise, is when you have a persistent reading of a greater than 140 over 90. Now, what can lead to this? Some common causes are diet, obesity, age, race, heredity, stress, and smoking. Okay, all of these things can put you at a greater risk for hypertension. Okay, diet and obesity go hand in hand. The easiest way to lower your blood pressure if you are overweight is to lose weight. People ask me why. What does that mean? Why, if I just lose weight, then why is my blood pressure going to come down? Okay, you don't change the volume of blood that you have. Everybody has about 5 liters, whether you're small, medium, or large. Okay, and that 5 liters has to get pumped around your body no matter what your body size is. And not only do you have to pump the same amount of blood volume to more tissue, you've got to make blood vessels to supply the new tissue. So you've got to give your body more blood vessels to transport the same amount of blood. So the only way to do that is to increase the pressure. So if you're increasing the pressure by pushing and pushing and pushing the same amount of blood through more blood vessels, and of course your blood pressure is going to be high. The way to fix that is to get rid of that excess tissue, therefore get rid of that excess blood vessels and lose the pressure. Okay, then you don't have to have as much pressure to supply the tissues with the nutrients and oxygenation that it needs. I watched a show growing up called Trauma Life in the ER. And I mean, it was probably a telltale sign that, I was a weird anatomy nerd if I was watching that at 6 or 7 years old. But anyway, there was a doctor on there, and I've never forgotten this, that he was doing heart surgery. And I don't remember the details of the case, but he said, people who suffer from obesity, it's like they put on this heavy coat of weight. And they carry that coat around with them all the time. And it's heavy on their heart. It's heavy, and it's hard for their heart to supply that heavy coat of tissue with blood because it has to constantly be harder and provide that pressure to push the blood through the body. So the only way to really take that stress off of the heart is to take the coat off. And I think about that a lot. Just think about putting on all the clothes that you own at one time and how that would feel on your body. And then think if that were tissue, that were adipose tissue, what might that feel like on your heart? And so the easiest way, and one of the more recommended ways, is diet and exercise to help combat this hypertension. Now, if you have to take a medication to get you over the hump and get that blood pressure back to normal, then of course, if that's what's medically prescribed to you, then do that. Heredity is another one. So if you have parents or grandparents who have hypertension, you might just want to be aware of that and be proactive about your checkups and about checking on your hypertension if you start to show the symptoms of it. And just knowing that about your family can really help prevent some issues for yourself. All right, now the opposite of that is hypotension. Okay, and hypotension is low blood pressure. Okay, low blood pressure is often felt a little bit differently and a little bit quicker than high blood pressure. High blood pressure is almost like a silent killer because it happens so slowly that you may not notice the signs of it. Whereas with hypotension, a sudden drop in blood pressure is going to make you feel weak. It's going to make you feel lightheaded. It's going to make you feel really yucky, okay? And it can come on rather quickly. There's 3 examples of hypotension that we will talk about. And the first one is orthostatic. And orthostatic hypotension is just a temporary drop in blood pressure. Okay, so temporary decrease in blood pressure. And it's going to cause dizziness due to a change in position. Okay, if you may have potentially overslept or hit snooze too many times, and you look at the clock and you think, oh, I'm late for school, let me jump up real quick. And then when you jump up, you suddenly feel dizzy and you think, ooh, I'm seeing stars for a second. Okay, that is technically orthostatic hypotension. It is a temporary drop in blood pressure, could cause dizziness, could cause you to feel a little woozy due to some change in position. You jump out of the bed, your body's got to compensate for that change in position. You've gone from horizontal to vertical. And if it doesn't have enough time to get that blood supply up to your brain, then you may have that dizzy feeling and it should go away. Now, if it doesn't go away, or it happens every time you stand up, or happens 7 out of 10 times that you stand up, then you may be diagnosed with orthostatic hypotension and they need to figure out why. My godfather had orthostatic hypotension and started showing symptoms of it. And every time he would stand up, he'd get that woozy feeling. And they went in and did a scan of his neck and realized that he had a blockage in his carotid artery, which is the artery that supplies your head and neck with oxygenation or with oxygenated blood. And if there's a blockage there, obviously it's a traffic jam. You can't get that blood up to the brain. And so they went in and cleared out his carotid, and symptoms got a lot better. But it's not just a one-time deal, or it wasn't just a one-time deal for him. And so they had to figure out what the root of the issue was. Another one can be chronic. And chronic just means long-term, or not a quick or sudden onset of hypotension. And chronic low blood pressure may indicate poor nutrition. Okay, and that can change something called blood viscosity, which is the thickness and stickiness of your blood. And if you show signs of chronic low blood pressure, chronic, even anemia can be another sign of this. It may mean that you just don't have a proper diet, or you may need to change some of your nutritional needs to get that blood pressure back up to a normal range. And the last one is acute. And acute and chronic are opposites of one another. And acute high blood pressure, or low blood pressure, sorry, is an important sign of circulatory shock. Okay, so it is one of the important signs. Now this brings up a topic of review, the differences between signs and symptoms. Okay, remember, symptoms are only felt by the patient, whereas signs are measurable, okay, and they are objective readings that the doctor is going to use. So an acute drop in blood pressure is a sign. It is measurable, and it will indicate the potential for circulatory shock. And circulatory shock may indicate a bleed somewhere, or may indicate that someone is having a heart attack, or someone has vessel damage, or somebody has an aneurysm that's leaking, or internal bleeding in the belly. It can mean anything. Okay, it normally just means that there's something systemically going on with their circulatory system. They need to get to the root of it. Somebody comes in from trauma, they come in from a bad car accident, a gunshot wound, and they're fine. And then all of a sudden they're not fine, and their blood pressure starts dropping to very scary levels, and they may go kind of out of it. That is acute or sudden onset of hypotension or low blood pressure. All right, so let's keep moving here. Get another piece of paper. And with high blood pressure and low blood pressure, or just blood pressure in general, let's see here. Okay. One little factor that I want to talk about are other factors that can influence arterial blood pressure. And, not just hypertension coming from obesity or from smoking or from poor diet, or the opposite, coming from poor nutrition. What I want to talk about is, what does our body have that is going to influence arterial blood pressure? So these are going to be factors that influence arterial blood pressure. Okay, and the first one we'll do is heart action. So the action of the heart. What is the heart telling us, and how might that lead to changes in blood pressure? And this is actually done with a mathematical equation. So even though this is anatomy, we can do a little bit of math, not a lot. I mean, I'm not a math teacher for a reason, but the math of this is CO is equal to HR times SV. Okay, so let's talk about what that is. The first one is cardiac output. And all of these things are going to describe heart action, which is going to influence blood pressure. Okay, first one is cardiac output. Cardiac output is the amount of blood pumped out of each ventricle in 1 minute. Okay, so how much output do I have of each ventricle? How much is my right ventricle pumping to the lungs, and how much is my left ventricle pumping to the body? Okay, in a minute. So the cardiac output is measured in the amount of blood per minute. The next one is heart rate, and we're familiar with that. Okay, so your heart rate is just the amount of times that your heart is going to beat in 1 minute. Beats per minute. Third one is stroke volume. And the stroke volume is the volume of blood pumped out by one ventricle each beat. Okay, so now I'm not looking at the overall output. I'm looking at how much does each ventricle beat. Let me say that again. How much blood does each ventricle pump in each beat versus in a minute? Okay, that didn't come out very clear. Let me use some numbers here to describe this to you. Okay, so with cardiac output, we're going to take the averages for a person. And the average heart rate for somebody is roughly 75 beats per minute. Okay, we'll just take an average. Now that can change. That's going to change if you're sitting at your computer right now versus, walking through the neighborhood or climbing the stairs or doing whatever. Okay, so that heartbeat, we're just taking an average of 75 beats per minute. And the average stroke volume is going to be the volume of blood pumped out by one ventricle each beat. Okay, not in a minute. So this is every individual heartbeat, and that is roughly 70 milliliters of blood per beat per ventricle. Okay, and that gives us a cardiac output of roughly 5,250 milliliters per minute. And I'm just going to do a unit conversion here and change this to liters, okay, which is roughly 5.25 liters per minute. Okay, our beats cancel out, doing a little bit of unit conversion here. All right, so that means that cardiac output, which is the amount of blood pumped out of each ventricle in 1 minute, is roughly 5.25 liters per minute. The average amount of blood in the human body is roughly 5 liters. So that means that we are pumping our entire blood volume around our body every single minute. It's pretty crazy. And at any given time, 60% of it is sitting in our veins. Remember, we had the capacitance and reservoir vessels that held on to that blood and lazy rivered it back up to the inferior and superior vena cavas. So at any given time, we are circulating 5.25 liters per minute on average of blood, which is our cardiac output. Now that is one thing that can influence arterial blood pressure. Okay, you increase cardiac output or you increase heart rate, you're going to increase cardiac output. You increase stroke volume, you're going to increase cardiac output. Same thing would be true if you decrease that. And we'll look at ways to control that with the nervous system on the next lecture. Another thing that can influence your arterial blood pressure is peripheral resistance. And peripheral resistance is an opposition of flow. Okay, resistance in my mind is slow to flow. What would happen, or what could be causing this peripheral resistance, the opposition of blood flow, which can then influence blood pressure? Well, the way to interfere with pressure is to increase it or decrease it. But how do I increase or decrease pressure in a blood vessel? Okay, sure, your heart can pump harder. Sure, you could have a clot or you could have a plaque buildup. We won't think about that right now. Okay, what is the nature of the blood vessel that can lead to the opposition of flow? The only ways to do that is to interfere with that blood flow by friction. Okay, so this opposition of flow is a measurement of the amount of friction that the blood vessel, I'm going to say this again, the amount of friction that the blood is going to encounter in a blood vessel. Okay, so it is the opposition of flow and is a measure of the amount of friction blood encounters in a vessel. Okay, how do you do that? Well, a blood vessel, specifically arteries in this case, have 5 layers. And those added 2 layers that we talked about in the lecture from the other day were elastic layers, and they kind of sandwiched smooth muscle. That smooth muscle is going to contract, and because a blood vessel is round and tubular shaped, when it contracts, it's going to constrict. If we vasoconstrict, that is going to increase the friction that the blood encounters. Therefore, it increases peripheral resistance and would increase blood pressure. Okay, so vasoconstriction and vasodilation are ways to interfere with blood pressure. Okay, so vasoconstriction is going to increase peripheral resistance. Vasodilation is going to decrease peripheral resistance, therefore decrease blood pressure. And the same thing would be true up here. If we increase peripheral resistance, we increase blood pressure. It's like a garden hose. Squeeze on that garden hose, you're going to feel that blood and feel that water traveling through that tube. Okay, that's increasing it. That's increasing the resistance, the opposition of flow of that water in the garden hose. Increase that, we increase the pressure. Let go, then we decrease peripheral resistance in that garden hose. Decrease blood pressure, the pressure within that hose. Okay, I think I feel so about that. I think that can be enough for the first part of the blood pressure information. And what we're going to do after this is part 2 of the video. And I will do neural control of blood pressure, where I will include how we increase and decrease heart rate, which is then going to interfere with cardiac output and pull in peripheral resistance and the homeostatic balance of blood pressure and neural control of that. So take a little break, come back for part 2, and those will be handwritten as well. So you'll need a couple more pieces of scratch paper for that info. All right, see y'all back shortly.